condition that affects many expectant mothers worldwide, anemia occurs when there is a decrease in red blood cells or hemoglobin levels, leading to reduced oxygen delivery to both the mother and developing fetus. Since hemoglobin is responsible for transporting oxygen throughout the body, a deficiency can have significant effects on maternal health and development of fetus. So mild anemia is quite common during pregnancy due to an increase in plasma volume, which naturally dilutes red blood cells. However, anemia is officially diagnosed when hemoglobin levels fall below 11 grams per deciliter in the first and third trimester, and 10.5 grams per deciliter in the second trimester, as defined by the World Health Organization. So the most common cause of anemia during pregnancy is iron deficiency, which accounts for approximately 75% of cases. This happens because a pregnant woman's iron requirement increases significantly to support the growing fetus and placenta, as well as to compensate for the higher blood volume needed during pregnancy. Other causes of anemia include folate deficiency, vitamin B12, and chronic diseases, and inherited blood disorders and such as thalassemia. And now let us proceed to the next report.
Clinical manifestations. Anemia during pregnancy presents with a range of symptoms depending on its severity. In mild cases, many women may not notice any symptoms at all. However, as anemia progresses, the body struggles to deliver enough oxygen to tissues and organs, leading to noticeable effects. One of the most common symptoms is fatigue and weakness, where women feel constantly tired even after adequate rest. This is due to the reduced oxygen supply to muscle and organ, making daily activities more exhausting. Other key symptoms is pallor or paleness, which can be observed on the skin, nail beds, and conjunctiva, the inner lining of the eyelids. This occurs because there are fewer red blood cells circulating the body. Dizziness and lightheadedness are also common, especially when standing up quickly. This happens because the brain isn't receiving enough oxygen-rich blood, leading to temporary drop in blood pressure. Women with anemia may experience shortness of breath, even in minimal exertions. Climbing stairs or doing simple tasks can feel unusually difficult because of the body is trying to compensate for the lack of oxygen. Palpitations or an irregular and rapid heartbeat can occur as the heart works harder to circulate oxygen throughout the body. This can be accompanied by feeling of anxiety or discomfort in the chest. Other symptoms include headache, cold tolerance, and pica, a condition where individuals crave non-food substances like ice, clay, or dirt. Pica is particularly concerning because it can lead to nutritional deficiencies and worsen anemia.
Assessment and diagnostic findings. To diagnose anemia, doctor perform several tests to identify the type, cause, and severity of the condition. The first and the common test is the complete blood count, or CBC. This test measures the three key components: hemoglobin, the protein in red blood cells that carries oxygen. Low hemoglobin often confers anemia. Hematocrit, which shows the percentage of blood make up red blood cells, and red blood cells indices like mean corpuscular volume (MCV), which help clarify anemia, macrocytic, normocytic, and macrocytic, depending on the site of the red blood cells. Next is the peripheral blood smear, where a drop of blood is examined under microscope. This allows doctor to look at the size, shape, and the color of the red blood cells, providing more clues about the type of anemia. For example, small pale cells suggest iron deficiency anemia, while large cells might indicate vitamin B12 or folate deficiency. Dig deeper into iron levels, doctor orders serum ferritin, serum iron, and total iron binding capacity TIBC test. Serum ferritin shows how much iron is stored in the body. Low levels usually mean iron deficiency. Serum iron measures of the amount of iron in the blood. And TIBC check how well iron is transported, which help determine if the body is truly iron deficient or another issue is at play. Folate and vitamin B12 levels are also checked. Deficiencies is that this vitamin can lead to a specific type of anemia called megaloblastic anemia, where red blood cells become usually large and ineffective. Finally, the reticulate count evaluates how well the bone marrow is producing new red blood cells. A low count might indicate bone marrow problems, while a high count suggests the body is trying to compensate for anemia by making more cells. By combining the result of this test, doctor can pinpoint the exact cause of anemia and develop the best treatment plan for the patient.
First is the nutritional counseling, promoting an iron-rich diet with foods like red meat, leafy greens, and fortified cereals. Next is the iron supplementation, oral iron tablets best taken with vitamin C to enhance absorption. Third one is the management of underlying condition, addressing chronic illness and malabsorption disorders that may contribute to anemia. Last one is the blood transfusion, reserved for severe cases where immediate intervention is needed. Aside from dietary and medical management, pharmacology and therapy plays a crucial role in treatment. Let's discuss the next.
Pharmacologic therapy. Pharmacologic treatment includes: first is iron supplement. Ferrous sulfate is the most common, but it may cause side effects like nausea and constipation. Next is folic acid. Pregnant women are advised to take 400 to 800 mcg daily, starting before conception to prevent neural tube defects. Next is vitamin B12. In cases of deficiency, cyanocobalamin is administered either orally or intramuscularly.
As nurses, we play a critical role when it comes to assessing, supporting, and educating pregnant women with anemia. Nursing interventions include monitoring vital signs and laboratory values like hemoglobin and hematocrit. We should also be educating our patients on the importance of a balanced diet and proper iron supplementation. We should also be promoting compliance with prescribed treatment and managing side effects. And we should also be observing complications such as preterm labor and low-weight births. Additionally, we should be providing emotional support to the patient or the mother to ease her concerns. And we should send referrals to specialists for further evaluation and management of the patient. By implementing these nursing interventions, we could help improve maternal and fetal outcomes. In conclusion, anemia in pregnancy is a common yet manageable condition. Early detection, proper supplementation, and comprehensive nursing care are essential for ensuring a healthy pregnancy. By educating expectant mothers and providing timely interventions, we can prevent complications and promote the well-being of the mother and baby.